Hi, today we will be discussing on fetal hematopoiesis, which is a recent December 2019 question. So, this will be a single slide education. Hematopoiesis in the fetal period starts initially in the yolk sac, which is the extra embryonic part or otherwise called mesoblastic. It starts around 10 to 14 days and ends by 10 to 12 weeks. So, what is taking over the mesoblastic stage? That is the hepatic stage. It starts around 6 to 8 weeks, midway between these two, and starts decreasing and ends around the second trimester. So, what is taking over from the hepatic hematopoiesis is your bone marrow. Bone marrow starts from the second trimester. So, till then, till around 20 to 24 weeks, hepatic hematopoiesis reigns predominance in utero period. So, the mesoblastic or the yolk sac stage starts at 10 to 14 days and ends by 10 to 12 weeks. Hepatic starts at 6 to 8 weeks and decreases by second trimester, predominates till 20 to 24 weeks. Bone marrow starts from second trimester and then on, that is going to stay as the predominant mode of hematopoiesis. The hematopoietic stem cells are capable of differentiating into any sort of hematopoietic cell. They are broadly classified as colony forming unit GEM, granulocyte, erythrocyte, monocyte and megakaryocyte, and colony forming unit CFU is colony forming unit lymphocyte. Lymphocyte is pretty simple. It will differentiate finally into T cells, B cells and natural killer cells. Whereas your GEM subdivides into colony forming units erythrocyte, megakaryocyte. So, your RBCs and platelets are friends, and all your WBCs, rest of the WBCs are friends, granulocytes and monocytes. The erythrocytes are going to develop finally into, of course, erythrocytes, your megakaryocyte into megakaryocyte, which is finally going to give rise to your platelets. Your granulocyte and monocyte colony forming unit give rise to colony forming unit N, which stands for neutrophil, B for basophil, E for eosinophil and M with the suffix O is for monocyte. If you see the suffix K, it is megakaryocyte. So, this is how the colony forming units form finally. So, this is just to say the hemangioblast can differentiate into endothelial stem cell and the hematopoietic stem cell, and the hematopoietic stem cell is what we saw right now. According to the site, the predominant cell may vary. For example, in yolk sac, RBC, megakaryocyte and macrophages. Note that we have not talked about lymphocytes here, we have not talked about granulocytes here. It is RBC, megakaryocyte and macrophages in yolk sac. In liver, the RBC mainly predominates, and in bone marrow, all three cell lines. If you take the WBCs, the macrophages precede the neutrophils and the ratio of macrophages to neutrophil decreases as the gestation progresses. If you want to look at the indices of each of these cells, your MCV and MCH is maximum at around mid trimester, 22 to 23 weeks, and thereafter decreases linearly. And even at birth, if you see, the MCV is generally on the higher side. If you look at week wise and day wise nomograms, you will see that what you consider generally bigger cell, macrocytic cell for an older child is actually normal for a neonate. Whereas your mean corpuscular hemoglobin concentration and your mean platelet volume, this will remain standard throughout gestation. MCH stays standard at 34 plus or minus 1, whereas your mean platelet volume stays standard at 8 plus or minus 1. This is picogram, I think this is picogram per deciliter. Okay. All right. So, this is about the cells in general. If you want to look at hemoglobin specifically, because again hemoglobin is also asked as a frequent question, not just in your theory, also in your MCQs for your postgraduate and SS entrance. I thought I will just cover the overview here. So, hemoglobin is broadly divided into two, the heme and the globin part. Heme is the iron containing porphyrin ring. Globin has 4 chains in it, 2 alpha and 2 beta. The alpha chains are determined by 4 alpha genes in chromosome 16, whereas the beta chains are determined by 2 beta chains or 2 beta genes rather, not chains, genes. So, 2 alpha chains by 4 alpha genes The beta chain are by 2 beta genes in chromosome 11. So, alpha is 16 and beta is chromosome 11. This hemoglobin differs depending upon the gestational period. So, embryonic hemoglobin are these three: Gower 1, Gower 2 and Portland. Alright. The Gower 1 and Gower 2 have the epsilon chains as the common factor, whereas instead of the alpha part you have zeta 2 in Gower 1 and alpha in Gower 2. Okay. Portland and HbF has gamma 2 in common with each other, and similar to Gower 1 and Gower 2, if you see, Portland and HbF has zeta 2 and alpha 2. So, it is easier to remember that way, that is why I put it up like this. At around 6 weeks, the fetal hemoglobin starts developing more and more. Hemoglobin F is alpha 2 and gamma 2, and by mid gestation your hemoglobin A starts becoming more and more. This is determined by BCL11A gene. Hemoglobin A is again divided into A1 or generally represented as A and hemoglobin A2. A is alpha 2 and beta 2, whereas A2 is alpha 2 and delta 2. The hemoglobin A and F, if you see, it's like a dance. The hemoglobin F starts becoming lower and lower and lower, whereas hemoglobin A starts becoming higher and higher and higher as the gestation progresses. For example, hemoglobin F starts predominating by around 6 to 8 weeks, whereas hemoglobin A, it's only around mid gestation and later on. By 24 weeks, if you see, hemoglobin F predominates up to 90%, whereas hemoglobin A is only 5 to 10%. It has started producing only around that time. By third trimester, around 70% is hemoglobin F. It has reduced. The rest of the 30% is by hemoglobin A. At around term, if you see, the hemoglobin A starts becoming 30%, or in third trimester. Yeah, you can say it either way. So, 30% around term is hemoglobin A, rest of the 70% is hemoglobin F. At around 6 to 12 months, hemoglobin A is the predominant one. It is similar to adult values, whereas hemoglobin F reaches adult value around the same time, which is less than 2%. What about hemoglobin A2? Hemoglobin A2 is less than 1% at birth, and it reaches the adult value of 2 to 3.5% at around 12 months. The ratio of A1 to A2 is 30:1. So, I think that is it about your fetal hematopoiesis. If they ask hematopoiesis, talk till this point. If you have time, you can include the hemoglobins also. If they want to ask you about hemoglobins, you can include this, but then again you need to include some more points if you want to write a full 10 marks theory on it. I think we will see it in another class. So, thank you guys for listening to me patiently. Bye bye and all the best.